In this section now we will talk about the fractures of the lower third of the face. In this we will go over the overview of the lower third of the face and then fractures of the mandible and then oroantral fistula. Fractures of the lower third. The categories of the fractures of the lower third, we have the fractures of the mandible. This is the mandible, the lower jaw bone, and this has the lower teeth. So this is all the mandible, lower jaw. So the categories of the fractures of the lower third, we have the fractures of the mandible and also oroantral fistula. Fistula is the connection between the two parts. With the injury of the lower third, sometimes there is a formation of fistula between the oral cavity or the mouth and the antrum of the maxillary sinus. So oroantral fistula. Fractures of mandible. This is the mandible bone. This is the simple fracture of the mandible bone with no involvement of the skin or the laceration present or no protrusion of the bone out of the body. So this is simple fracture. This is the compound fracture in which the bone actually involvement of the skin also. And this is the comminuted fracture or comminuted fracture in which the bone breaks down into pieces. So fractures of the mandible classified according to the location. Condylar fracture, condyles of the mandible, this area is most involved in the fracture of the mandible. Due to direct or indirect trauma, displacement of fractures is determined by, very importantly, pull of the muscle on the fragment of the bones, and then also by the direction of the fracture line, in which direction the fracture line is present, and thirdly is the bevel of the fracture. Bevel is the tip or the point of the fracture. So all these factors play an important role in determining the displacement of the fracture of the mandible. Clinical features associated with the fractures, clinical fracture of the condyle, usually there is pain, and here if you see, this is the condylar process here. This is the condyle portion of the mandible. This is the angle and ramus of the mandibular bone. Then we have the body of mandible, and this is the symphysis of the mandible. So condylar portion is most commonly involved in the fracture. There is pain and trismus, and tenderness is present. Also teeth malocclusion and jaw deviation, because this is very close to the temporomandibular joint and the movement of the jaw is affected and there is deviation of the jaw. Fractures of the angle, body and symphysis. This is the angle, body and symphysis. If this is involved in the fracture, then there is intraoral and extraoral palpation, ecchymosis of oral mucosa, and tenderness and crepitus. So these are different clinical features associated with the area of the mandible that is involved with the fracture. Diagnosis and treatment is by X-ray, usually postero-anterior PA view and panorex view are used. Right and left oblique mandible views are also used. Treatment is by the closed methods, which include interdental wiring and intermaxillary fixation, external pin fixation. So interdental between the teeth and intermaxillary between the maxilla and the mandible. Usually wires are used to fix the fracture. A pin fixation is also used. For open methods, fractures, exposure, direct interosseous wiring, fixation via compression plates. So all these are different methods used for the treatment, which can be closed method and the open method. Condylar fracture, usually intermaxillary fixation, mandible immobilization is performed. Oroantral fistula. It is a communication between the antrum and oral cavity. Fistula's opening may be situated on alveolus or gingivolabial sulcus. So it's the connection between the antrum and the oral cavity, and the location is mainly on alveolus and gingivolabial sulcus. Gingiva is for the gums. Clinical features of fistula: because of the connection or junction, there is regurgitation of food and discharge. So whatever we eat, there is regurgitation or going back of the food and discharge. Inability to build pressure in the mouth. Etiology is dental extraction can be one cause of antral fistula with the extraction of the teeth. Failure of sublabial incision to heal. Erosion of antrum. Fracture of maxilla and maxilla osteitis, syphilis, granuloma. These are all the causes that can cause the formation of the fistula between the oral cavity and the antrum, leading to regurgitation of food and discharge. Diagnosis and treatment. This is the fistula present, is the opening between the oral cavity and the antrum. Diagnosis is pro-pass from fistula's opening in antrum. Treatment is, if it's the recent fistula, not very old, suturing of gum margins, antibiotic course. Chronic or large fistulas, they are treated by surgical repair. Sinusitis leads to irrigations and antibiotic treatment. And excision of squamous line fistula tract. And we have Caldwell Luke operation. Closure by dental obturator. So these are all the treatment options. If the fistula is recent, not very old, usually the suturing of the gum margins to close the fistula opening, surgical repair and antibiotics are used. But for the chronic type of the fistula and large fistulas, it's important to do the surgical repair of the fistula. If there is sinusitis involved, then we should do irrigation and antibiotic treatment, and excision is performed of the lining of the fistula's tract, Caldwell Luke operation, and closure by dental obturator. All these are the different treatment options for the fistula. Thank you for watching sqadia.com.